Good afternoon to all. And hello to our keynote speakers. It was really a great presentation. I really liked the work and it was very informative. For the starting point, I would like to start from my own question. As you mentioned, the biggest problem of the analysis is data, like data collection, finding data, collecting the data. So I'd like to ask, how do you define the perfect data in your terms? According to your career path, what's the perfect data?
Is it an order for answering, or anyone can answer?
I think anyone.
Well, I can start. I mean, I can give you the examples for the COVID-19 work that we've been doing since March. I think it's become evident during the COVID-19 pandemic that there's been a data scarcity and a data quality issue. To tackle the data quality issue, we have mainly used different data sources to try to answer the same question using these different data sources to have more robustness in the answers that we were finding. For example, when we wanted to estimate the prevalence of COVID-19 in early April, and there were no tests in Spain, so we couldn't really rely on the number of reported cases because we knew that it was only roughly 10% of the number of real cases. So we used 3 different methods to try to estimate the prevalence, and then we got some confidence intervals of where roughly the prevalence was. We used the excess of deaths. We used the underlying number of infected people in our epidemiological model, and then we used the survey, the citizen survey. And in fact, one of the motivations for us to launch the citizen survey was to address precisely the data scarcity and the data quality challenges that we have been facing, in the pandemic. In other scenarios, if you are able to characterize the kind of noise that the data has, then you can apply techniques to denoise the data or to filter it. But in situations like COVID-19, we've followed more of a strategy of computing the same answer from different data sources with different methods as to have more robustness on what the answers were.
I guess I can. Yes, I can give my take on this. I think working with imperfect data is the important thing that we must do, especially in this sort of scenarios. One example on how we had to deal with that was the fact that in early stages of the pandemic, not many people were tested. So we had sound data from lots of people. I mentioned it in my talk. We had sound data from lots of people who probably were having COVID, but they hadn't been tested. So we had no ground truth, no information about that. Well, we obviate this by using data from countries where COVID was not prevalent. And this was our kind of way of working with imperfect data. I think in the end, the whole point is that once the models are developed on large scale data, so you have enough data for that is able to add this sort of noise and to still work despite the noise, then you don't need the ground truth anymore. And that's the whole point. We will be able to distinguish those users that did the questionnaire, did the sound questionnaire, and they weren't tested, but according to our result, they were probably COVID. So this is a very specific example, I know, but I think the whole point is that we have to work with what's there.
I would also like to share my thoughts about the concept of perfect data. So I think from all of my experience these years, there is no perfect data, or one could say that perfect data is kind of a moving target. So when we start working on a particular problem, oftentimes we don't have a good understanding of what we are looking specifically. So at that point, we are not able to answer what kind of perfect data we would like to have. Then as we move forward, working with the data that we have and collecting potentially more data through the mechanisms that we have in place, for example, logs that we collect on our servers or through the software that we have, then we realize that perfect data is not going to happen. And what type of problems do we see? First of all, we see problems at the collection. So oftentimes it is the case that we collect fewer kinds of data than we would like to have. So we have more needs, but unfortunately, for many different reasons, we collect fewer types of data than we would like to have. Then the second thing that was already mentioned by Nuria is the fact that we may have very scarce data, very sparse data. And even when we see the data that we would like to see there, it is hard to actually run any statistical analysis, find patterns and things like that. And I think that the third problem, the third challenge is that even if data is there, it is not in the perfect form that we would like to have it. For example, having textual data, let's say we want to run a COVID analysis on Twitter data based on the tweets that people share. The information may be there, but it is very well hidden. So we need to develop all these technologies to be able to extract the information and put it into some, not perfect, but some workable version or format.
And thank you so much for great answers. My second question will be, like everybody is talking about the big data and big data size and etc. So from your experience, how big your data have been? Like what was the biggest size of data that you have been working so far? And how you dealt with the hardware issues and software issues in there?
Well, I have dealt with really big data sets because I've been working in telecommunications companies for many years, and the volumes of data are huge. It's like petabytes, but the companies have really a state-of-the-art infrastructures for distributed computing, large-scale storage. So we were using, the tools that are, what you need to use when you have large-scale, systems. So I guess one of the advantages of doing research in industry is that usually all the infrastructure is somewhat taken care of because the company is analyzing the data for a variety of purposes. So in that sense, we didn't have to do all the kind of like more kind of like low level technical solutions for data capture, data storage, and so forth. We could just focus on actually the algorithms for analyzing the data and measuring the quality of data also and so forth. But I've dealt with really, really big data sets from the mobile network infrastructure.
Yeah, and so, about the cost issue. So yes, you're not concerned because the company is taking care of that issue.
So on my side, I worked in academia, and the two biggest projects are crowdsourced mobile data projects. And there, we're talking about thousands more than millions. And the issue there is not about the big aspect of the data. Is more about the heterogeneity and the fact that there are a variety of ways in which the data is collected. To give you a few examples, it comes from different devices, it comes from different sensors. People are inputting data with ranges and ways of inputting and using perhaps the scales differently. In the case of, again, the example I've given in my talk, the sounds, we have people that really want to give us very, very good data, and so they put their phones very, very close when they breathe or cough, and this has unwanted effects because then the microphone interferes, and so all these things add to the complexity. It's big is not just, to me, a number. It's I guess a parametric thing. It becomes really complex very, very quickly.
Mm-hmm. Sure. And Georgia,
actually, I think that both Nuria and Cecilia have covered me.
I think we should let you speak first next time.
Yes, we should change the order.
No. I think I like the order. It gives me time to reflect on what you have said. So I have worked both in the industry and the academia, and you can see different things in its environment. So in academia, oftentimes we may have a problem of actually finding the right data to work on. Right now in the European project that I'm involved, we actually have a lot of data because we work with 3 use cases that are concerned with cancer data, with astrophysics and policymaking. Policymaking is perhaps the most reasonable data set in terms of size, just a few gigabytes. The other data sets are, especially the astrophysics that has also images, is in the range of petabytes. And the astrophysics dataset is coming from the SDSS survey that I mentioned during my talk, and it grows every night. So it's kind of a moving target how much of this data we can actually put into some shape and analyze. Now, while in the industry there, we see many different types of data sets. We have data sets that we collect through the systems, for example, computers and printers and so forth, but also we have worked with logs that come from the various products. Different sizes there. I think I liked what Cecilia said, that it's not the size that troubles us. We're okay with that. We have lots of hardware to store what we want. The problem is that once you put it there, you have to find what you want to do with this, and heterogeneity, and also the different forms and the different types of users that want to have access to this data put a lot of challenge into what we want to do, because some of them may want to access this part of the data, do a particular type of analysis, some other want to do something else, and these are conflicting things, and sometimes you need to think, how you should actually process this data in order to put it in a form that would be accessible by all these different types of users.
Mm-hmm. Yeah, perfect point. And we have question from audience, I guess. I'd like to someone to say it. Perfect data is not going to happen. Do you agree or disagree? This statement.
I will start.
Yeah, go ahead, Georgia.
So that I break the chain. I saw this question earlier, and I was thinking that perfect data probably is not going to happen on one hand. On the other hand, I don't know if I want perfect data to happen, at least in all cases. So, for example, if we collect perfect data for health purposes, this is an absolute must. I mean, I wish it happens. Now, if we collect other perfect data for monitoring purposes, for example, citizen monitoring, there are some gray areas there. This is where I'm getting at, that maybe perfect data is should not be wished or desired. But there are other cases. Again, health is my top priority, that perfect data would be an ideal. I'm not sure how far and how fast we can go there.
I mean, I think I don't think perfection exists anywhere. So I don't. You have to define what you mean by perfect data, because I don't. I don't know. I don't know how would I define perfect data. Just from the fact of data being a digital representation of an underlying physical phenomenon, there is going to be inherent noise, and I guess to answer whether piece of data is perfect or not, I guess you have to answer what for and for whom. And, kind of like picking up on what Georgia was saying, maybe massive surveillance data is perfect for totalitarian governments, but it's definitely not perfect for the citizens that are the subject of the surveillance, right? So I think, but I think part of real life is that perfection doesn't exist. So I wouldn't know how to define perfect data unless maybe it's in a strictly mathematical sense, which probably there are very rare situations where that will happen.
So if we want, my study to work, the perfect data is data that comes from devices in the hands of users in their daily life in the wild. So the perfect data is a very confused data, a very different and heterogeneous data set. And so being able to build models on that is the perfect process. So I think I'm just, I'm the third this time, and I'm kind of repeating and verifying what Nuria and Georgia have said. Yes, we can have, there are, in my case, there are examples of detection of sounds done in clinical, perfect, clean settings where the data was collected in a sterile environment, but those models are probably kind of useless for the kind of application that we were trying to build.
We have another questions. Let's see. With the data collected during the COVID-19, would you think the answers provided by the people in the online survey reflected the actual feeling of the people? Is there a way this could be factored in? I think at the first instance, it's for study from Professor Nuria Oliver.
Okay, thank you. Yeah, so it's a very good question because the survey is a self-reported survey, which also has selection bias because it's just based on volunteers who agree to answer the question. So it's non-probabilistic sampling. We have a publication in JMIR. I'm going to put the link to the publication in the chat, and in that publication we share the methodology and the different strategies that we follow to minimize potential biases in the data. For example, we reweigh the data to make sure that the sample has the same underlying distribution as the one reported by the latest census in Spain from 2019 in terms of gender, age, geographic distribution of the population, and professions. We eliminate answers that have inconsistencies in them. People saying, I don't have any children, but then they say that they live with children, or people, I don't know, people answering kind of like random answers. So we filter those out. We filter questions that don't have, for example, the zip code, and so forth. So there are techniques that you can use to try to minimize potential biases in the data. In terms of the emotional impact, which was, I think, is talking about feelings. So emotional well-being is generally measured by self-reporting. Different people feel happy for different reasons, and the levels of happiness or stress or anxiety are different. The question, the way we formulated the question for the emotional impact was, have you observed an increase in any of these dimensions that you consider damaging to your own health? So we are not asking, are you stressed out right now? We are asking, do you feel that you have levels of stress that you think are negative for you, like are really damaging to your own health? And that way we were trying to, in just one question, because of course there are standardized instruments to assess certain elements of emotional well-being, like standardized surveys, for assessing stress or for assessing, anxiety and so forth. But those entail many questions. And one of the key elements that I think has been part of the success of the survey, and that we, from the very first day, from the moment we started designing it, we were really committed to, was that the survey should be very short. So we couldn't afford to include 10 questions to assess stress and another 20 questions to assess anxiety, because then no one would answer the survey. So we wanted with one question to have a sense of the negative impact that the pandemic was having on all these different, variables in people's emotional state. Part of the results have been corroborated by other research, by other teams that have also done surveys, but generally emotional well-being, mental well-being is always assessed via self-reported. There's no machine that you can use to determine, unequivocally, how anxious or how stressed out or how lonely someone feels. It's something that is based on self-reported answers.
And Cecilia, Georgia, would you like to add something on this question, or?
Not really.
Well, I have not worked with COVID data, so I'm not an expert to say something here, like Nuria.
So let's pass to the next question then. I believe it's most related to Cecilia, but if you have any additions, you are free to add. Is it possible for health-related data to be biased?
Yes, I think I've given 2 examples in my presentation. We had a bias because people weren't being tested. So our data set was of people that didn't know if they have COVID or not. You can have age bias. We looked at the age distribution of the data. We looked at, how, who reported. And, it might happen that our crowdsourced endeavor as a targeted people that were using a mobile phone more and were in certain countries rather than others. You can have all sorts of bias, and a consequence also health related. Perhaps the more concerned people answer the questionnaire, the people that have, or we knew, for example, that people already in ICU wouldn't be possibly the ones answering our questionnaire. So there's a bias on the kind of data we have. We don't have the extremely sick COVID patients in our data set. So plenty.
And one more question. How can students, citizens, scientists, activists use data for their needs without sophisticated hardware, software, tips for simple devices and small budgets? Do you have anything to add on this? Like, it's related mostly to the people who have small budget and to do some resources and research on that case.
Well, I mean, I think something that is always fun and is a way to have more impact with limited resources is to join forces with other people and to collaborate with other people. Today, there are many opportunities to do so. There are many data-driven competitions, both in scientific conferences and platforms like Kaggle, where data sets are shared and teams, are supposed to perform certain tasks, on the data. And usually, a lot of the teams that are among the winning teams or the finalists are actually ad hoc teams from participants that initially didn't know each other, and then they started working together. So I think that's a potential nice way to have impact, to learn, and to work with other people. There is also, of course, the option to look for relevant grants that could partially at least finance some of the projects. There are a lot of financing opportunities in this space. This is a very demanded area with a lot of interest. Of course, it's also relatively crowded. It's getting more and more crowded over time. But having said so, there is also a very big lack of people with expertise in non-trivial, data analysis. So I think I would definitely encourage anyone listening to this, if they are considering, which area to work on. I mean, this is, I would say, one of the most fascinating, most impactful, most interesting areas. The work that we've done for COVID-19 has all been for free. So we've been killing ourselves in a very altruistic way. But we have applied for some funding that has come along the way from different funding entities. And so we've gotten funding, even though our original budget for the team was zero. We were all doing it because we wanted to help and because we believe, that we could help. But then, we found funding actually, because funding opportunities came in the context of COVID-19.
Is there any additions on this point, or I believe that Nuria covered all? Yes. Okay, so
I can say something if you want.
what? Yeah, would you
I
like
can
to
say
add?
something if you want.
Yeah, of course.
So I think, I mean, Nuria is right. Data is available. You don't need to get your own. People are volunteering COVID data. There's a lot of COVID data. If COVID is your focus, it's there. In terms of resources, software, and probably computational power, my feeling is that often you want to start small and maybe find partners after. So you don't need to really launch these big jobs on big GPUs for a start to understand the problem, to understand the issues. You can still start in an era of big data. I would advocate that we start with small concepts, small problem, the hypothesis, and small subset of the data first before you scale it up, because especially when you scale it up, often you do not understand what's happening, and there's this big box, black box problem often in what comes out of some results. You don't understand why you get some results. So a little bit of understanding is what you want to do first, and definitely that's something that can be done with low resources.
Georgia, do you have anything to add in this question?
No, I don't have something to add here.
Okay, and we have questions related to the career base. What would you say to young female, and not only young female, students who wants to build a career in the field of big data analytics?
First of all, I have a clarification question. The question says
Start,
young female and not only students. Does it mean not only young students or not only female students?
Yeah, it's it's a bit confusing question actually. I believe that let's say to young researchers or young graduates, to all genders and to all kind of people. So what would be your advice for one who wants to start career?
So I can start with that. If you can hear me.
Yeah.
Perfect. So it is a question that we hear a lot. We throughout our careers, but also right now in Greece, we are running an ACM chapter. And for 2 years that the chapter is run, we run a conference, and a lot of the young researchers that come in this conference, they actually ask this type of questions. It's a hard question actually. The easy answer would be just go for it. It's exciting. It is very rewarding. It is a career of the future. But I would like to go a little bit beyond that and say that you also need to take some action yourself. So one of the things that I have learned through my experience is that the best way to proceed if you want to do something like that is to actually have all your options open. Try to listen to other researchers, to other professionals, to other research opportunities. Don't just get stuck to one problem or to one topic and not being able to see what else is there. So I will use a very personal example about myself. I changed my topics a lot. So initially, I was very much intrigued into telemedicine when I was very, very, very young. Then I switched to networks, totally different topic. And then I was fascinated by data itself and what we can actually do with data. And that has captured my attention, my fascination for many years. One of the things that I'm trying to do is to actually try to develop tools that can help us do a better job with the data that we have. And by saying that, I mean trying to be able to find what we're looking for, to ask the right questions, to run the models that we want in an easier way. One of the problems, for example, that we were facing while I was working in industry was that there was a very small group of experts that essentially included programmers and developers, that actually they were the ones that had access to the data, but they were not the ones that actually wanted to use the data. So everybody else who actually wanted to use the data, like salespeople, like researchers, like the scientists, like consumers, they couldn't access the data because it was in a form that was not very friendly, or the tools were not very friendly. So again, they had to go through the programmers to actually find what they're looking for. So to bring this to home, I think big data and big data analytics is a very fascinating area to work on right now. It has many different problems to look at, and these problems also have and can have social impact. So you can combine all of these great things together.
And Cecilia, I'd like to hear your opinion about it.
I think just two suggestions. One is find something you're passionate about, because no matter who you are, I think if you have a long career ahead, you have to go a long way. You better find something you like doing. There's no point doing something you don't like, and you should have a choice. And the second point is find a good mentor. And it is hard, but there's choice. It doesn't need to be a formal mentor, but it could be someone that you can collaborate. It doesn't need to be a senior mentor. It could be someone just a few years older than you, but is doing things right. But those things are very important for support and for drive, really.
And Maria, what are your thoughts about this?
No, I mean, I think I agree with everything that has been said. I guess one of the advantages of working in sort of like data science, but I think it also applies more broadly to computer science, is that it's a very transversal discipline that can be applied to any field of interest. So if you're passionate about health, then you can actually apply both computer science or data science to the health sector. You're passionate about education, then you can do it in education. You're passionate about the environment, then you can do it in the environment, right? So there are very few disciplines that have this transversal nature that gives you so much flexibility. And Georgia explained a very clear example. She worked in telemedicine, then she worked in networking, now she's working on this, right? But you have this computer science background underlying. So I'm a great advocate and of encouraging young people to pursue a career in computer science, because I think it's one of the most versatile disciplines that you can study, and that enables you to have a very long career that you will never be bored with, because you have always like interesting new things to do. Yeah.
Sure. And I would like to ask a question from my own. So in my experience, I always face some data visualization problems. So for instance, the company has provided us with some tool, but it doesn't really meet all my requirements. So I would like to hear your opinion that which data visualization tool you use in your career, like in your work, and which one is the best from your experience?
I didn't. Can you type the question? I can't really hear very well.
Do you hear me?
No, it's better.
Okay. So my question is, I usually face with the problem of the data visualization tool, like to find the best possible data visualization tool is really difficult for me. So which data visualization tool you advise for us, like the one that's gonna be not too expensive and that's gonna be easy to use, like non-code or etc. So which one is the best from your own experience?
I think it depends a lot on the nature of the data, the type of the data, the volume of the data, whether it's a temporal, sort of like time series type of data, or is a static data. We have used Kepler, we've used ArcGIS, we've used Tableau. and I'm not sure we have necessarily paid for, I mean, there are licenses for academic institutions and for students and things like that. But I mean, in my experience, it depends a lot on the nature of the data and what you want to do with it. I'm not sure there is one unique tool that will be the visualization tool for any kind of data. It depends a lot on the data itself. Yeah.
Okay. And do you have anything to add, Cecilia and Georgia?
No, I don't.
Okay. And we have a question from audience. How do you see the current growing distrust in science impacting data science? Especially since as data scientists, we want to provide more numbers and facts to show, prove the concept of idea, which end up being rejected by people. Any steps you take to regain the trust in science through the data science as well?
Well, this is a hard question. I do not think we can change the political charge of some of the distrust in science that are happening these days. That is probably something that it's dependent on so many more things. I think we can do our best to provide understandable results. So it doesn't help to publish a very scientific paper if we don't then take the next step to explain those results in more understandable terms. So the more outreach we can do as scientists to explain where we are and what the results mean, the more likely is that someone will pick it up in policymaking and government to do the right choices and to then allow trust to happen. Sorry, I know I'm not answering the full question, really.
Yeah, actually, the full answer, I think, to give it is impossible as well. But what do you think, Maria and Georgia?
Well, I mean, I always think about trust within the framework of 3 conditions that I think need to be met for trust to emerge. The first one is competence. So in this case, it would be being able to articulate a scientific explanation or justification about a certain topic that, as Cecilia was saying, that people would understand, not that other scientists would understand, but that the average citizen, I don't know, your grandmother, or your mother would understand. And this is very important. The second one is reliability, which is competence sustained over time. So providing scientific explanations that indeed over time, once and again, they show that their value and they show that they are an accurate explanation, of what is happening in the world. And the last one is transparency and honesty. So doing it in a way that, people realize that there's no hidden facts or that there is no, hidden, anything. I think one of the challenges that we are facing is related to the way we are consuming information, where it's become a very superficial, one sentence, one headline, clickbait kind of phenomenon right now, and it seems that we live in a permanently state of distraction, and we go from, one headline to the next without barely ever reading the content behind this. And that generates some, strange image of the world that a lot of people have, just from reading those headlines that are in many cases or sometimes generated by algorithms to optimize and maximize the chances that people will click on them or will retweet them. So how do we move away from such a culture? I think is a very complex, much broader, topic. It's a topic that, I am personally very interested in, but that is, difficult to tackle because, yeah, I mean, one of the ideas that we had and one project that we did a few years ago was related to boredom. So we feel that we might be losing the ability to be bored as a species. And we know that boredom exists because it does play an evolutionary role. Boredom is very highly correlated with creativity. Moments of boredom are moments where your brain is not busy processing all these inputs, so it has a chance to actually process everything that is perceived, and generate, outputs. But we all have mobile phones in our hands now, so we are waiting for the, minimum amount of time that we don't have any stimuli, like we're waiting in a traffic light, to be on our phones, being stimulating ourselves. So our question was, are we losing the ability to be bored because we are constantly, self-stimulating with a mobile phone? And so we built a system that was able to detect, your phone was able to detect if you were bored or not. And our idea was that the phone would actually, one of the ideas that we wanted to explore was that the phone would actually suggest that you turn it off if it was detecting that you were bored. So the underlying philosophy or the underlying question is, why don't we design technology that recommends us to turn it off? Why is the expectation that the technology that we use is always trying to maximize the amount of time that we spend using it? And we are constantly, in this sort of like permanent state, as I said, of sort of like distraction. And why aren't we exploring alternative interactions and alternative ways of having a relationship, with technology? Why doesn't my phone tell me to turn it off ever? Maybe it could be an interesting thing to explore, right? But yeah, I mean, I do think that technology is playing a role in augmenting and create sort of like creating a very large amounts of people that that are sort of like distrusting a lot of elements, including science.
And Georgia, what's your opinion on this?
So this question actually is very pertinent to what we actually experiencing with the COVID pandemic. So from the moment that this pandemic appeared, we started to get bombarded by news on new studies that show this or that, and things that you should do, and things that correlate. And if you have this, then you could more easily get COVID, or if you don't have this, maybe you don't get COVID. And uh, initially, we all as citizens, we all started to, read all these different news stories and studies and try to understand how we can fight or how we can handle this new situation. And soon you end up exactly in what the question describes, not necessarily distrust, but you are skeptical about whether you should accept what you read or not. And questions like, okay, do you have enough data for this study? Um, do you have enough evidence to support these numbers that you got? And if you actually go inside these studies and see them as a scientist, at least, you start realizing that maybe they don't have all this data, or at least required data to support what they are saying. So it's initial. Most of them are initial studies, and the result is that by having all these different studies coming out, and I'm connecting also that to what Nuria said earlier, and newspapers and online sites were actually using these studies as clickbait. Um, we ended up not caring about these studies, and if something very useful was said, it would probably go unobserved. So the question is, as scientists and as data scientists, how can we actually prevent this misuse and this mistrust that is created? And I think that at some level we are also responsible for that to some extent. For example, if I'm doing a research and I'm publishing a paper just for the sake of publishing a paper, while my numbers are just based on, let's say, 100 people, and my data set is extremely small, then maybe it would be a good idea to either not publish it at all, or at least make it very clear that this is an initial study. It doesn't lead to any, conclusions that are certain, and more steps are required, and so on and so forth. So these are thoughts that essentially arise from what we see with COVID, but also happens with other occasions as well. And I want to actually take this opportunity to ask a question to Cecilia. Um, there was an earlier question with regards to bias data, health data, and I was wondering, when I was listening to your talk, Cecilia, you are trying to collect data from essentially sound-based data, which is great. But then I want you to, share your thoughts with regards to how much confidence one should put on this data, and how this data should be combined with other data related to health and COVID in order to come up with some prediction or conclusion with respect to whether, for example, this patient has COVID, or other types of insights and conclusions.
Thank you. I can try to answer that. We've been asking ourselves that question for a while. So we think that symptoms, it has been, so there are lots of surveys that have collected symptoms for COVID, and there are millions of entries for that. And they've proven, they were the first to say that, for example, smell and taste loss was important as an indicator. And I think that audio, in addition to symptoms, could give an interesting additional idea. I don't think we should rely only on sounds to be completely discriminating, and at least we're not there at this point, of the disease itself. It could be, I see this tool as a pre-screening tool where you have a possibility of false positive that is accepted, but because the tool is cheap, you essentially, it's a referral tool. I'll give you another example. Now, in England, students went back to school and they have colds, right? They have colds that are being kind of misdiagnosed into COVID, and all these people are being tested, and being tested means that we're running out of tests. What if, with the sounds, we could detect that actually it is a cold, or it's likely to be a cold, and we're saying, well, wait a little bit. You probably don't need a test right now, maybe later. And this would rebalance the testing situation. So I don't think the answer is one substitute the other, is a thinking of mechanism to use different inputs at the right time for the process to become better.
Yeah, true. And I have to say that unfortunately, Nuria is going to leave us now. She has urgent event to attend. So Nuria, we want to thank you so much. It was really informative. We learned a lot today from you. And I would like you to add some points in here, if possible.
Thank you. No, it's been a pleasure. So thank you for the invitation. I have really enjoyed the panel with Cecilia and Georgia, and congratulations on the organization of the conference. Everything has worked pretty flawless, which is not easy. I was in a conference this week organized by the European Commission, and the technical difficulties were horrible in terms of the audio quality and the video quality and everything. So congratulations for running a really smooth conference, and thank you for the invitation. Bye.
Thank you so much. Bye-bye. And Cecilia and Georgia, we will continue with you a little bit more. And we have one more question in here from audience. Question is, do you collaborate with professional mathematicians to process data? If yes, how does this collaboration look like?
I mean, I think the line is blurred between computer scientists and mathematicians. So, you know, I know of some of my colleagues that have a first degree in mathematics and now are doing data analysis. I don't think I distinguish. I have collaborated with a few. I don't know if the question had a sort of second meaning that I'm missing here.
maybe mathematician wants to know whether they will be okay for being data scientist or not. Maybe the question is that. So if someone has mathematician profession, so he can be very easily be a data scientist. Yes, it is your point.
I think there is a ramp-up curve on putting those models into practice of tools, learning to program, for example, and maybe some mathematicians are not trained into that. But the collaboration could also work. I have some more mathematically inclined colleagues who write beautiful models, and then in collaboration with others, this model can be translated and used. So they probably also don't need to, if they find the right team, they don't need to learn to program themselves. They could collaborate.
True. And Georgia, what do you think about this?
I have worked with let's say this hybrid essentially person or professional that is a mathematician but has an active participation in computer science problems. And I think most of the times this is the case. So there is a learning curve always, not only working with mathematicians, but also, for example, working with doctors.
Mm-hmm.
There is a learning curve for both us and doctors. There is a learning curve when working, for example, with other types of scientists, because each one brings their own expertise, experience, and also their own requirements and scientific language. And there is some period that everybody needs to understand each other and their language and their requirements, and then I think then things work very nicely, because in many of the problems that we need to solve right now, most of them are actually interdisciplinary. So they cannot be solved, for example, by just a computer scientist or by just a doctor or or a meteorologist. They need collaboration from many different from many different disciplines, and I think that's the beauty and that's the promise for us.
And I'd like to ask one more question. Like, what was your biggest challenge so far that you have faced besides the data problems? Like, you have a data problem, you have solved it, and you have done some data processing in there. But after that, for instance, finding the best possible solution for getting some patterns and etc. What was your biggest challenge on that, and how you deal with it?
I actually think when you deal with data, there are challenges along all the way. I think one of the most important challenges is how you actually once the data is there, let's assume that the data is there, how you actually process it and bring it into a form that can be actually used and be useful to the communities that they want to use this data. And oftentimes it was the case that we had to put a lot of work there and had to tackle a lot of difficult and sometimes almost unsolvable problems to be able to bring the data into that form that would make it valuable for the intended users. And then once you have this, of course, the second big challenge is that, again, that links back to the perfect data. Assume that you have the perfect data, it isn't the perfect form, and you are ready to do miracles with the data. The question is that as a scientist, for example, you may be sitting in front of the data and not knowing exactly what you can find there, what type of questions you can do, what type of experiments exactly, what type of things you want to, what type of things you are going to find there. So the big challenge is how can we jump in as computer scientists and help with developing tools to make the data more simpler, if you like, simpler and more accessible to the people that want to use it, to scientists, to citizens, and so forth.
And Cecilia?
So in my case, especially for the study, but for one other study, getting people to know about our tool was a big problem. And that has meant that I was on the news, on the media, trying to highlight what we're trying to do, trying to tell people that we had this tool and they could install it and they could give us the data. In another study we've done, always with crowdsourcing user devices input, was a study where we were collecting mood reports. And in order to keep the users engaged, we had to have a good user interface. So the user really need to be happy to input their data with the device. And in some cases, giving something back to the users has proven useful. So for example, we would give them very, very simple reports, statistics of what they've inputted, and and this was enough to keep them engaged. So finding the right way to get to your users so that you get the data you want and explain clearly what is the data you want was a challenge. Then I can talk for an hour about the challenge of convincing Google and Apple that the apps that we were deploying were research apps with a good aim instead of exploitation apps for data gathering related to COVID. They have this policy, and quite right, because I guess many people were giving data, producing apps to exploit the COVID event, and therefore they were blocking all sorts of apps. And so we had to really talk to them at length. It took a month to get approval to do this study. So it really required a lot of leverage.
And one more question we have. Big data became a buzzword. This trend of having lots of big data analytics courses, certificate programs, training programs, sometimes even with a tagline with no CS required. What do you think about this? CS computer science, I guess they wanted to mean. And what do you think about this one? If the one doesn't have any computer science skills, will they be able to work with big data? I guess the question is that.
I didn't hear the question, I'm afraid. Maybe Georgia can answer it.
Sure. So it is a fact that we love to have all these different buzzwords, and big data has become one of them. There are also other related buzzwords like data lakes and so on. We do see a lot of training and seminars and related material online that speak of big data. If you see the tag no CS required, then I assume it is just for people that want to understand superficially, at least, what is big data, and get an encyclopedic, if you like, understanding of the term and the area. But if you really want to work with big data, then you have to have some CS background, or as we were saying earlier, some mathematical background, because a lot of oftentimes we need mathematics to help us work with our data. So no CS required is another maybe buzzword, but it's not a reality.
Yeah, sure. And I believe that there are not so many questions. Yes. Is there anything left? Okay, one more question I guess we had, and after that we can wrap up. Talking about explainability, is it really possible in the deep learning age? If yes, is it worth sacrificing some efficiency?
So that is something I have been looking into, especially because I believe that with deep learning and machine learning, we really don't want to substitute clinicians. We want them in the loop, and we want to be able to use some of the results to inform them and get back their feedback, and really keep the process really tight. And so there are approaches related to machine learning that are probabilistic, and they introduce this concept of uncertainty. And so it's not all about accuracy. It's not just a number. It's some sort of ability to understand if the prediction is accurate and to what extent it is accurate. And all those approaches, to me, are very, very common. Now, in terms of efficiency, we're looking into possibly even putting these sort of uncertainty-based estimations on device. I have 1 or 2 PhD students looking at these aspects. And so, yes, I think it is a very good question. And it is important that we as a community go down that line for all sorts of data. I'm doing it for the kind of data I'm interested in, so mobile and wearable data.
And what's your thoughts, Georgia?
And it is, in fact, it is true that when we deal with deep learning methods, it becomes extremely hard to understand why a specific output is seen. And it is very hard because we're talking about models that sometimes may have millions of parameters. So how can you, even if you could possibly find a way to explain what is happening, given that you have so many different parameters, how would a scientist, for example, understand what is going on? So you need to find a way to limit your parameters and say that these are the most important ones that actually contribute to this particular output. And actually, this is the idea and the intuition that many of the current efforts for developing such explainability approaches are using. So they're trying to essentially explain what a deep learning model is doing by using, for example, sometimes a simpler machine learning model or a much simpler mathematical model that just finds the parameters that are responsible for producing a specific output. But then at this point, these models, what they lack is that they cannot, they're not generalizable. So they cannot explain any type of output that a deep learning model would generate. But it is also true that currently trying to make models self-explainable and also trying to make models being fair there is a lot of growing interest and attention to this problem because it is very important. Earlier we talked about biased health data. And imagine what happens when your data is biased or when your algorithms is biased. Then the output is maybe catastrophic. So how do you find bias and how do you explain, for example, to the user that here you see this because I actually think there is a bias there and you may want to take care of that before we proceed. So there was a simple example that is often heard about related to health that we are using as our example today. So there was this big a study on using data about people that had asthma and pneumonia, and the machine learning model that they built on top of this data concluded that people that had asthma and got pneumonia, they had fewer chances of getting of dying, which of course is not true because people that have asthma have higher risks for getting worse. But the data was biased because the data was actually showing people that had asthma and pneumonia, but they went straight to the doctor, so they avoided any bad consequences. So this is an example where the algorithms should have the intelligence to say that, here we see that, and let me explain what is happening. We are not there yet for sure, but this is of great importance and something that we are working as a community.
Sure, very good points. I guess we have finished all questions, and I would like to thank you again. It was really very nice to see you and meet you face to face. And I would like to have your final sentences on our today's meeting, if possible.
Thank you for inviting me. It seems to be a very well organized event, and to all the people who have attended, I hope that you found your path, and I hope you will stay in research and academia and data science in any form you find, and find your passion.
Thank you. And Georgia?
I also would like to thank you for the opportunity to be involved in this great event. And being a virtual event, I think didn't stop it from being a great event and having all these great talks and discussion. So I would like to thank the organizers, but also the participants that during the panel shoot us with all these interesting questions, and hopefully, we contributed to some more thinking, and hopefully we also contributed to people getting more interested in working in all these problems that they are out there. So thank you.
Thank you too. And I would like also thank you to organizers, to Araz Malim for selecting me as a moderator today.
I want to thank Chinara possibly on behalf of everybody. So despite of all the technical hurdles, she managed very well. And then certainly Georgia, Cecilia, and Nuria, she's on her way to Madrid. She had to run to the train station. So we are very grateful for you. Thank you for joining the event. And I loved so much this discussion, so many nice insights. I've been watching the comments. Many participants were actually quoting some of your words in your speeches. So thank you so much. The only one big thing I'm missing is the lack of applauses. So I believe we would have great applauses now in our large auditorium, but we are hopeful that the situation will change and we will be able to host you sometime in our beautiful campus. But this is also a good possibly startup idea for virtual meetings, somehow be able to simulate the applauses based on individual input. So thank you so much. It was a great pleasure to have you. We continue. This is first day. So we will have the second day as the second day of our conference. Thank you very much, Georgia. Thank you very much, Cecilia and Nuria. We are grateful to her too. Thank you.
Thank you, Araz. Thank you, Chinara.
Okay, thank you so much. Bye-bye.